Hi everyone, I'm Jill Chodak. I'm a registered dietitian with the Center for Community Health and Prevention with U of R. And today we are going to talk about the holidays, all the treats and sweets, and how that might impact your eating over the next couple of months. So no matter what you celebrate, I'm hearing in my clinic talk about intermittent fasting, about overall health, and other trendy diets. So today I thought I would kind of take on intermittent fasting a little bit, very briefly. And then if you have any further questions, you can always talk to your healthcare provider about them or consider getting a dietitian to discuss it further. So some of the considerations for intermittent fasting that I discuss with my patients are the social restrictive aspect of it. So meaning intermittent fasting, you're eating between usually 8-hour segments. So maybe it's from 8 to 4 or things of that nature. And so part of what I think about when I think about any eating pattern is, what's that look like socially? Especially given the recent pandemic that we had where we really felt the isolation. I'm mindful of that for us going forward. And so if we think about something like intermittent fasting, we have a lot of parties, hopefully, or gatherings or dinners or get-togethers with our family. And if we're doing something like an intermittent fasting, that's going to really restrict us socially to not enjoy some aspects of those gatherings, to the point where it might affect our joy, our overall connection with our families. And that's a huge player in our heart health and our overall health and our mental health and so on. So that's a consideration here. Another consideration is it's really nutritionally restrictive, intermittent fasting. It's less eating overall, less time to eat, and it's really hard to get fiber, generally speaking, in a whole day. So restricting that time frame makes it even more difficult. Puts a lot of pressure on what choices you are making in that window. And then if you don't get enough fiber, you're not getting enough electrolytes, polyphenols, phytonutrients, and all those other things that our body needs to run. And so, in fact, this can be a factor as well. It's not just a calories in, calories out type mentality. We have to think about the whole body and all the nutrients that it needs. Additionally, any type of restriction can sometimes be an eating disorder trigger, meaning if you have tendencies to have disordered eating or over restriction, this can lead you down a pathway of further restriction. I do see it in my clinic, and it kind of can be a gateway to leaving out other things that we might so need. So be careful there. When we think about making healthy eating changes, it's crucial to think about long-term changes because those are shown in research to be more positive and beneficial for overall health. The so-called yo-yo dieting can actually have negative impacts on our health. And so with intermittent fasting, this is often not sustainable for many people. And so again, because of the social aspect, the social emotional aspect alone. And so considering this to be a fad diet would be something that I would agree with. It's not necessarily sustainable over a lifetime. And so adjusting it to become so would be more beneficial. There are also unproven claims of positive or negative impact. There's a lot of research that goes back and forth. And so until we have actual data that we can kind of interpret and use, we do have an alternative in the Mediterranean diet and eating pattern that does show positive health changes over a spectrum of time. It's been rated the #1 eating pattern for several years running. And so we do know there are other options out there besides intermittent fasting that show positive results. So choosing that over something like intermittent fasting might be a beneficial takeaway for folks. So some suggestions that I do have, besides kind of unpacking the intermittent fasting, is that dietitians actually look at a variety of variables when we're considering what might be right for our patients. Timing is just one of them. There's a multitude of things. So it's important to consider all the variables on the spectrum of life when we're considering something that eating related, because we're humans, not robots. And so it's crucial to overall health to do so. One size does not fit all when it comes to diet. I've said this for years now, and it's key. It really is. What's good for you might not be good for your neighbor, might not be good for your sister. And so really think about that when you're hearing all these folks, these celebrities kind of amp up intermittent fasting. It's important to think about those things as you're making considerations for yourself. Say, oh, okay, that might not work for me because of X, Y, Z. And if you don't know, a dietitian can help you figure that out. What does controlling timing solve? A lot of my patients driven toward intermittent fasting are trying to avoid grazing throughout the day. And so restricting that time frame is a means to an end. And in fact, we have other ways, other strategies to deal with that if that's one of the obstacles that you face. And so thinking about, what am I really trying to do and control? And are there alternatives here that can support me even better? Adding a dietitian, like I said, is key. And then also thinking about food and an eating pattern as adding versus subtracting, meaning I'm focusing with my patients on how can we add fiber, how can we add diversity, add cultural effects, add nostalgia, add moments of time throughout the day where you might not have thought you had some to impact the health physically and mentally, versus the diet culture that we live in, which tells us to restrict everything. Thinking about fiber for the win, you know how I feel about fiber and adding that. And then also, like, what about water? We keep talking about food, but if you're dehydrated, this absolutely affects everything about you. We water our lawns. What about our body? We absolutely need to think about hydration and what that does for our overall health. So focusing on a long-term eating pattern over a fad diet would be crucial here. And if you don't know what to do this holiday season, we are absolutely here for you. So please reach out. We're here to support, and we hope that you have a great holiday season. Thanks for watching.